As a medical practitioner, knowing how to document patient interactions is important. One convenient way that physicians draft medical records is by following a SOAP checklist. SOAP is an acronym which stands for Subjective, Objective, Assessment, Plan. Each letter represents a different section of the SOAP note. Preparing and completing proper SOAP checklists means filling out every section. The subjective section is where you'll write down all the information the patient tells you about their condition. This information comes from questions you ask your patient, like where is the pain, or what symptoms have you been feeling. Make sure to ask your patient how long they've been sick, what their lifestyle is like, and if they are taking any medications. Next comes the objective section, which is based on your observations of the patient. Here, you will examine your patient according to what they mention in the subjective section. It's also possible that you'll find something during your examination that goes beyond what the patient has told you. This is the section for raw, numerical data, like the patient's height, weight, blood pressure, BMI, and body temperature. The exact factors you measure will depend on the symptoms your patient is reporting. After you've collected subjective and objective data, it's time for the assessment stage. Taking all the information you've collected, you'll come up with a diagnosis. The assessment stage is also where you will order diagnostic tests to confirm your theory and record the results. Finally, it's time for the plan section. Write down the steps needed to treat your patient according to the diagnosis you made earlier. This treatment plan should include any medications, therapies, or operations that your patient needs. Make sure to clarify whether or not your patient is allergic to any of the required medications, because in that case, you will have to find an alternative treatment. Then, specify how the treatment will proceed, including the frequency of treatment and the dosage of medications. When you have completed your SOAP checklist, make sure to add your signature so you can formally add it to your patient's record. A workflow automation app like Lumiform helps you design and fill out SOAP notes easily, so you can always offer patients the best care possible.